What is the nursing process? The nursing process is the method that we use to take care of our patients. The nursing process is a systematic 5-step process that we use to get data, have a plan, implement that plan, evaluate the outcome. So let's talk about it. ADPIE. We all hear about ADPIE. What is ADPIE? So ADPIE is an acronym for us to remember how we use the nursing process. ADPIE, A is for assessment, D is for diagnosis, P is for planning, I is for implementation of that plan, and E is evaluation of whatever interventions we place for our patient care. So ADPIE. Today's topic, nursing process. Nursing process, all these phrases. Oh my God, it's a lot to learn, a lot to remember. Let's do it. A for assessment. Assessment. We do a lot of assessments. Any nurse can tell you, we are assessment specialists. We assess our patients and their families every single time we enter the room, we talk to them. Every time a nurse encounters a patient, we do an assessment. Assessment can be having a conversation or an interview with our patient. An assessment also can be clinical information. So let's say the patient comes into the hospital and the patient is telling you that, nurse, I'm feeling thirsty, extra urination, I'm lightheaded, I don't know why, but I feel like I can't keep my eyes open. That is clinical data that you can take as a nurse to figure out what is wrong with your patient, because that is the information that we need. We need that clinical data, as well as the medical records, as well as our assessment on the spot. So if your patient presents to the ED or to your unit and try to decide what our patient is at risk for or what is actually happening at the time. So remember, our patient is having this frequent urination, thirsty. As a nurse, our critical thinking skills will kick in, right? Critical thinking is one of our various ingredients to become a registered nurse. So again, we take this information and what is our next step? We're going to diagnose this patient. So remember, A is for assessment. So we're going to assess our patient based on observations. We're going to be doing their vital signs. But what else would I do for that patient besides vital signs? With those symptoms, frequent urination, dizzy, sweating, lightheadedness, always feeling thirsty, we're going to check the blood sugar. That is an assessment. We check the patient's blood sugar based on the information that they give to us, okay? So that will be one of the assessments that we'll be able to get the information. So D, diagnosis. So the nursing process, we diagnose our patients, a nursing diagnosis, not a medical as in a doctor's diagnosis, nursing diagnosis. Using clinical judgment about the patient to identify actual or potential problems. That is what we do on step 2 in diagnosing our patient. We do a nursing diagnosis. So based on the clinical information, all of that information we got from our patient, we will use our nursing skill to create a diagnosis based on the presentation. So example, our patient, we can say example is deficient fluid volume related to hypoglycemia, because our patient's blood sugar turned out to be what? 40. Risk for falls, because that patient could fall because they're lightheaded. So based on our assessment, we as the nurse can make a diagnosis on our patient. Okay? So here we have deficient fluid volume related to hypoglycemia, and we have risk for falls. That's just 2 examples of the many nursing diagnoses we could come up for our patient presenting with this sort of clinical data. Okay? Next step will be planning. So what can we say? Planning. Planning for our patient care. It means that after assessing our patient, diagnosing our patient, we have to make a plan how we are going to manage this patient based on our diagnosis and the patient's clinical presentation. So our patient in this scenario has a blood sugar of 40. So we have to create a plan for our patient. Now, this plan is supposed to be individually made for every different patient. You do not make plans and just add it to anyone. You have to make an individualized plan. The plan also has to be measurable. It has to be specific. It has to be measurable, has to be attainable, it has to be right at that time, and it has to be timed. So it is something that you must be able to measure. You must be able to it must be applicable to the situation at the hand, and it can be timed. So in this scenario, our patient, we have long-term goals and short-term goals for our patient. So let's see what is our long-term goal and our short-term goal. In this scenario, our long-term goal is patient will know how to check blood sugar by the date of discharge. So we know our patient is obviously having to check their blood sugar because they were at 40. And we know the regular parameters is 70 and above. 70 to at least 110. We accept that. But when a patient's blood sugar is below 70, they are considered hypoglycemic. So we need to be able to teach our patient, educate our patient on how to check their blood sugar. Our short-term goal will be patient's blood sugar will be above 70 mg/dL in over 30 minutes. Now, let's look at this goal. Is this patient-specific? Yes. Is this measurable? Yes, because we want it to be above 70. Is it relevant to the situation? Yes, our patient's blood sugar is at 40. And is it relevant? Yes, it is relevant. It is specific to this situation and it is measurable because we gave it a time. So we wanted to check our patient after we do our interventions. We are going to check our patient after 30 minutes to see if their blood sugar is going to be above 70. So remember, we're using the acronym SMART. So we're saying our plan must be specific, it must be measurable, it must be attainable, which means it's realistic, you could achieve the goal. It must be relevant to the situation and it must be timed. So SMART, when you think of your planning stage, remember SMART, okay? So SMART, we know our plan, how it's supposed to be created using the acronym SMART. Specific, measurable, attainable, relevant, timed. So let's look at our plan. So our plan is to administer glucose tabs as ordered, to administer a sweetened drink, to educate on glucose monitoring, and to recheck blood sugar after 30 minutes. Isn't this meeting all the criteria? It is specific to this patient. It is a measurable situation because we're going to be checking the blood sugar after 30 minutes. It is attainable because the blood sugar will go up after giving the patient glucose tabs or a sweetened drink. And it is relevant to the situation because our patient is having an episode of hypoglycemia, as well as it is timed because we have a time here. We are rechecking it after 30 minutes. So remember, think SMART when you are creating your plan for your patient. It must be patient specific, it must be measurable, it must be attainable, relevant to the situation, and timed. Okay? Interventions. So interventions. So you're asking yourself, wasn't that just the interventions? Yes, it was. So the interventions as well as the plan, it comes together like this. Okay? Remember, ADPIE is this big pie. So I'm from Trinidad, so we like macaroni pie. So think about the pie, a big macaroni pie, where all the ingredients comes together and it makes this really nice, tasty food. So ADPIE is the same concept. So remember, we're using the clinical data. We take that information from our patient. We take that with our knowledge and create a diagnosis. Then we plan. We make the plan using SMART. Then we create interventions. Interventions is right within the plan. So I planned what my interventions was. I originally planned a long-term goal and a short-term goal. Now I have my interventions and I'm going to implement it. So how do I do that? I literally said it. I am going to administer the glucose tabs as ordered. So whenever your patient has a low blood sugar, you inform your provider the patient's blood sugar is low. If you don't have a diabetic protocol to activate as a nursing protocol, in different places they practice different speed of reaction. Some people, they let you give the sweetened drink immediately because that is easy. You can give a patient a cup of orange juice to drink, or you can give the patient the glucose tabs as ordered. If you have it ordered, you can give the patient that. And also you can educate the patient as well about monitoring their blood sugar, because when you give the patient the medication, you can tell them, why am I giving you the medication, what we will be looking for, and how important it is that I give you this medication. Okay, so now we know we have assessment, we have diagnosis, we have planning, implementation, now evaluation. This is tricky, the evaluation. So didn't Toya put the evaluation on the plan already? Yes, my evaluation is also there. So remember, the nursing care plan, the nursing process, everything comes together. Everything comes as one big circle. Do not make it overwhelm you when you're in class and they're using all these words and you're like, oh my God, what is this? It's very simple. The whole concept of what we do as nurses is to take our patient information, take it from the patient, use the knowledge that we learned in class in pathophys, all the different diseases we have learned from the different symptoms we have learned, create a diagnosis, then we create a plan using SMART, then we list our interventions, because documentation is very important for us. If we do not document, it means we did nothing, okay? If it's not documented, it's not done. Interventions. We list our interventions. When we list the intervention, we're going to say, I administered this. It's going to show on your MAR because you have to give it from your medication record to say that you give the glucose tabs. In your nurse's notes, you say, I administered a glass of sweetened drink to patients, 250 mils. You put that in your intake and output chart. You educate your patient. Under education on your chart in your document, I educated my patient on blood sugar monitoring. And then we go and recheck our blood sugar at 30 minutes. So that's literally us evaluating what happened. So after 30 minutes, I go and I recheck my patient's blood sugar. This is part of my intervention, but it's also a part of my evaluation. Okay? So when we are evaluating, am I not assessing again? Yes. Circle. Big circle. I am back assessing, because how can I evaluate something? It means I have to check to see if what I did was working. Did it make a difference? Did it achieve the goals that I have in front of me? So what was my goals again? My goals was for my patient's blood sugar to be above 70 after 30 minutes. So my evaluation time period is going to be after 30 minutes. I have to go back and assess my patient again. Assess my patient again. Big circle. ADPIE. I love it. I do it every day. I love this. Nursing is awesome. So remember, it's easy. Nursing students, don't get scared. ADPIE, it's easy. We are doing it every day. You're doing it every time you go in the room. Patient blood sugar was low. We check the blood sugar. Oh, this patient could fall. What would you? Make sure and put the patient on a bed with the bed rails up. Make sure you set your bed alarm, because you can't put all the bed rails up. That means that is considered a restraint if you put all the bed rails up, okay? So you have to be able for the patient to get off the bed, but your bed alarm must be on, okay? Next, what do? Implement the interventions we have here. So, what do I do after that? I recheck my blood sugar. I am assessing again. I document. What is our patient's blood sugar post? Our patient blood sugar was 80 mg/dL after 30 minutes. ADPIE. It is a big old circle. ADPIE. One big nice fancy circle. Okay? Do not think ADPIE, oh my God. No. The steps are really easy. It's really common. You do it all the time. You assess, you diagnose, you plan, you implement interventions, you carry out the interventions, literally, and you evaluate after. Let us do another scenario with another patient, okay? So this patient in this scenario now has presented to us with certain symptoms. Let's get into the symptoms. Our patient has shortness of breath. Patient is pale. The patient looks pale. This patient has lightheadedness and their HB is 6.5. So your mind should be buzzing. Buzzing. Okay, what's wrong with my patient? Shortness of breath, HB 6.5. Lightheadedness. They're looking pale. Okay, what is our diagnosis? Imbalanced fluid and electrolytes. Why? HB is 6.5. Deficient blood volume, HB 6.5. Impaired gas exchange, shortness of breath. Fall risk, lightheadedness. Yeah? Is your mind buzzing? Is it getting it there? Come on, students. It's easy. Don't make it be stressed. Don't make it stressed out about it, okay? So that's our diagnosis. Not in the order of prioritization, though. I just wrote them down, okay? So we know Our patient has shortness of breath. Patient is pale, lightheaded, and 6.5 is their HB. So they have imbalanced fluid electrolytes. They have deficient blood volume. We have a fall risk patient, and the patient is impaired gas exchange. So we go into the next step. What are we planning? Plan. Patient will have regular breathing pattern after 10 minutes. Patient will be safe from falls, and patient HB will increase by the next day. So we give it time. It's using SMART. Specific, measurable, attainable, relevant, timed. Remember, SMART. Patient will have regular breathing patterns after 10 minutes. Patient will be safe from falls, and patient HB increased by the next day. What is our interventions that we're going to implement, that we're going to carry out? Don't let the big words make you get confused. Don't let the big words make you get confused. I'll repeat myself. Nursing is very simple, okay? Interventions. 1, administer oxygen. Why? Because our patients have impaired gas exchange. So we have to give them oxygen. I can't breathe. Shortness of breath. Remember, think. Shortness of breath. What do we do first? I can't breathe. I can't breathe. What comes to mind? They need air. Give them air. Administer oxygen. Next thing. What do? We're going to be killing 2 birds with 1 stone here. 1 stone. No, actually 3. Because lightheadedness, the HB of 6.5 and pale will be fixed by doing this. Giving them what? 1 unit of PRBC as per ordered. Not you ordering it. Remember, not the nurse ordering it. The licensed provider is ordering it. Okay? So we're going to administer PRBC as ordered. We're going to do what? To prevent falls. Bed alarm sets. Mobilize with assistance. So that is our interventions that we are going to carry out. We are going to be doing that for our patient with that low HB, lightheadedness, shortness of breath, and looking pale. Alright? Now what do we do next? Evaluate. I have to go back to my patient and reassess my patient. That's what evaluation really means, right? Just to reassess, okay? I tell you, don't let the big words get to you. Going back to my patient and re-evaluate. I'm going to reassess my patient. Let's check. What are we going to do? We're going to recheck their breathing rate after 10 minutes. Because if I give you oxygen, I'm helping you breathe. Do you think our patient with shortness of breath would be okay if I give them oxygen? Yes. Yes. Give them the oxygen as ordered. Recheck their respiratory rate after 10 minutes. That's the evaluation. Recheck the HB in 6 hours post blood transfusion. So let's say you give the blood a finish at 1 o'clock. At 7 o'clock, you recheck that patient's HB. Okay? We know all of these things. You are not ordering it. This is just your plan here. This is basically a plan of care. Your care plan for your patient. Okay? And recheck the patient has no falls recorded. Because patients are fall risk, bed alarm set. So this patient is not supposed to have any falls recorded. So in a situation where a patient did fall, it doesn't mean that you didn't make a good plan. Remember, it is a plan. You're reevaluating. So if you see setting the bed alarm wasn't enough because your patient did have a recorded fall, or mobilizing your patient with assistance was not enough, you have to put other things in place. So let's say that patient did fall, you reevaluate, which is the evaluation time, and you see you need to add more to this and put, let's say the patient needed a mobility, something to mobilize with like a walker, crutches, equipment to mobilize, because you didn't put that in the plan before. You can evaluate and you can put in new interventions to support the ones that you already have. Okay? So that is ADPIE. That is the nursing process. A big macaroni pie to eat, or mac and cheese pie, or a big ziti, a big pie. Okay? Just a big pie that has all these ingredients coming together, and you take a slice of it and you use it every single day. It always makes that big circle and come right back around. So let's go over again. ADPIE. Assessment, diagnosis, planning, implementation, evaluation. Yeah, ADPIE. So remember nurses, remember students. Nursing is the best. We nurses, we do it better. We are awesome. And look out for the next video. We're going to get into some more things about critical thinking. Look out for my video next.